Thank you very much. So, ladies and gentlemen, and dear G7 colleagues, dear Jeremy, dear Maya, we have the top stars here for our discussion today. Dear ATACH members, here in the room or online, we are very happy, and it's a great pleasure to welcome you in Lyon today on the margin both of the One Health Summit, but also on the closing of the third G7 Health Working Group. Let me begin by warmly thanking ATACH and the WHO for co-organizing this event and by expressing how pleased we are to host all of you today. Over the past few years, we have witnessed a strong and encouraging rise in political momentum around the issues of climate health, and indeed the discussion between the head of state and government promoted by President Macron are very important also for our actions. This has translated into a series of major international commitments and initiatives, from the launch of ATACH at COP26 to the COP28 Health Declaration, the World Health Assembly Resolution on Climate and Health, the WHO Global Plan for Action, and most recently, the Belém Health Action Plan adopted at COP30. And soon the COP31st and the Health Day will be very present there to promote our ideas and position. In this dynamic context, ATACH plays a crucial role as a platform to turn commitments into concrete actions. And France is proud to contribute to this global momentum. We do so by supporting ATACH and the WHO, by endorsing the Belém Action Plan, and by making environment and health a key priority of our G7 presidency this year. At the national level, France has made the ecological transformation of its health system a strategic priority. We have adopted a national ecological planning roadmap for health with a clear objective: reducing greenhouse gas emissions by 5% each year until 2050 and ultimately achieving carbon neutrality. This roadmap is designed both to protect patients, healthcare workers, and infrastructure from the impact of climate change, and to strengthen the resilience of our health system by reducing its dependence on fossil fuels. Let me give just one concrete example. We are introducing, first of all, in France, a carbon score for medicines, one of the first methodologies in the world enabling the comparison of the carbon footprints of pharmaceutical products, which are starting to be implemented in French hospitals in 2026. At the same time, we are stepping up our efforts on adaptation. This includes assessing the vulnerability of health facilities, expanding telemedicine for crisis response, implementing a national heat wave plan, and improving water resource management in response to increasingly frequent growth. Our objective is clear: to make the French health system a model of ecological transition and resilience. But we all know that no country can make this challenge or can meet this challenge alone. Building a resilient and sustainable health system requires a coordinated cross-sectoral international approach, first of all. And secondly, we can learn a lot from evidence-based good practices in other countries and regions of the world. At the heart of this concept lies the One Health approach. As we gathered for the One Health Summit 2 days ago, France is proud to have taken this opportunity to launch the One Health and Beyond initiative, which is with a clear ambition to move from concept to implementation. And this initiative aims to better integrate the One Health approach into a national climate and health planning tools, including nationally determined contribution and national adaptation plans. It is not about duplicating existing effort, but about structuring and scaling them into a coherent, action-oriented coalition. It builds on recent momentum, including the Belém Health Action Plan, which France strongly supports. The plan provides a collective framework grounded in equity, climate justice, and social participation, principles that are at the core of our priorities. We discussed during these two G7 days the importance of the social dialogue involving communities, citizens, and the civil societies at large. So this is really an action-oriented coalition. France is committed to working with a core group of pioneering countries to demonstrate leadership and pave the way for broader international engagement. In this context, we warmly invite you to join this core group of voluntary countries. Your participation would be instrumental in shaping both the political direction and the operational design of this coalition, and in positioning your country at the forefront of integrated climate and health action. Let me also take this opportunity to highlight an upcoming high-level event on June the 25th, 2026 in Paris, co-hosted by the WHO, the ATACH Secretariat, and the French Ministry of Health under the auspices of the French G7 presidency. So that's going to be our next meeting point. This meeting will bring together representatives from G7 ministries and beyond, and health and environment, ATACH champion ministers, and we have an ATACH champion with us, with Maria today, as well as key partners from international organizations, civil society, philanthropy, and the private sector. Its objective will be to take stock of the progress, renew political commitment, and accelerate concrete action on climate and health with a strong focus on country-level implementation. The timing is particularly important as we approach key international milestones, such as the global stocktake follow-up 6 months ahead of COP31 and shortly after the G7 Leaders Summit. This meeting will pursue 4 main objectives. The first one is to renew the high-level political commitment and identify priorities for further action. The second will be to showcase the most impactful and successful country experiences. Third, to better understand countries' needs and expectations towards ATACH. And fourth, to strengthen cross-sectoral collaboration, particularly with the environment sector, in line with a health in all policies approach. This is the spirit of our G7 health. One of the key expected outcomes will be the Together for ATACH declaration, aimed at reinforcing our collective political commitment and providing a shared direction for future action. This meeting, just like the one today, are very important to milestones to align our priorities, to share our experiences, and to strengthen our cooperation. So, ladies and gentlemen, I wish you a very fruitful and productive discussion. Thank you very much. And I will give the floor now to Jeremy Farrar, our dear ADG at WHO, in charge of health promotion and disease prevention, and many other aspects and activities. So, Jeremy, floor is yours.
So, thanks very much, Jerome, and pleasure to be here. My French is even worse than Diarmid, so I will have to keep going in English, but I have reassure everybody I've started lessons, so be patient. So thanks very much indeed. Thank to French government, not just for the comments here today at this meeting, but for events of the whole week and the city of Lyon, because I think over the last 6 months, have we been involved in bringing things together. There was a huge fear that there was just so much being pushed into 1 week, but I think now as we get to almost the weekend, it has been an unparalleled success. So to the City of Lyon and the French government, thanks very much indeed. To ATACH, of course, but also to UNITAID. Thank you very much. And just a call out here to somebody who played the key role in ensuring climate was central to WHO's past, current, and future, Maria. And it also shows, looking how you are, that there is life after WHO. It's wonderful to see you. A few reflections. I think, as we've said many times this week, the world is facing an incredibly challenging time. And I think one of those moments in history when much of the years to come in this century are going to be defined at a political level and therefore at a societal level. And we know that there is a divergence going on and a fragmentation and even a polarization. And of course, this particular issue is one that drives some of that polarization. I'll come back to that a little bit later. But at the same time, there are some enormous health challenges. Whatever the geopolitical landscape is, the health challenges haven't changed. And you can focus, as we have done this week, through a One Health lens, and you could call out, depending on your own background, what those are: pandemics, antimicrobial resistance, the increasing NCD agenda, the burden of mental health on people. You could choose any of the disease. But in my view, these are ultimately symptoms of underpinning drivers, that if we do not address those underpinning drivers, we will constantly just be responding and reacting to change that's happening. And so the underpinning drivers are crucial. And what are those underpinning drivers? We could argue amongst ourselves what they are. In my view, they are, in no particular order, climate change and its environmental consequences. Number two, demographics, which I think is one of the great under-commented on areas. I would add to that inequality. Inequality within our societies and between our societies, particularly in the health arena, is driving health outcomes which are hugely different. And we're in the midst of this at the moment, of course, conflict. And actually, those are probably all interlinked rather than... So the plea here is not to lose focus on the areas of health and ill health, but if we forget that these are symptoms, in a way, of underpinning key drivers of the 21st century, demographics, climate, environment, inequality, and conflict, then I think we will be constantly reacting. I wouldn't get too worried. The academic community, for which I've been part of for most of my life, sometimes loves to define and argue about whether this is One Health or whether it's planetary health or whether it's some other sort of health. Let's focus on actually the actions, as Jerome said, that come out of it. And I think there is a growing, as well as things I mentioned earlier, there is a growing mistrust amongst our societies and our communities of what governments, institutions, organizations, philanthropy, industry, what are we doing for the lives of people? And there is a disconnect coming in many of our societies. And I think a sense that an elite, which frankly we are all part of, is somehow talking in abstract terms, but forgetting to address the key issues that affect people's lives. So grounding this in communities, as has been said all week, grounding it in the concrete outcomes rather than in abstract concepts, I think is crucial, and address what matters to people's lives tomorrow morning, next Monday, next Tuesday, rather than talking about in the abstract sense. And that is why in my previous life, when at Wellcome we prioritized climate, we also faced a huge challenge because we were a science-based organization and proud to be one, but we were also a science-based organization that struggled with complex systems. And this, as has been said all week in the One Health context, is where you have to bring multidisciplinary and interdisciplinary work together, and that's very difficult. And in fact, we only, in my view, made progress at Wellcome when we appointed a social anthropologist to lead the climate change work, because in this case, he was capable of looking across sectors, and that is crucial. Scientists like myself tend to go down verticals, and you need somebody that understands complex systems. We also prioritise this in the general programme of work at WHO, and Maria deserves enormous credit for pushing, occasionally bullying, occasionally with a bit of charm and a smile, but eventually bullying one out. and we had to give in. But of the 6 priorities, what is number 1 and number 2? It was the impacts on health of climate change. And that tells you a lot about the priorities of WHO going forward. And I'm delighted to say that in the reorganization, which has been very painful, this comes in under my area of work. Diarmaid and Rudiger and others took over the mantle from Maria, and it comes under my division. So delighted to do so. And also in that same group is One Health. So we have reformed painfully in 25, but by doing so, we've brought things together rather than splitting them apart. And I think that really helps our ability to contribute. What can we do? Science and evidence. We are smaller. We will have to lean on you more than we've done in the past, but we will be focused on the scientific evidence, our convening power, our work through country offices and regional offices, and our country support and our technical support. That's our key area of work, and through the Collaborating Centre Network we will build stronger links. The Berlin Health Action Plan I think was critical through the Brazil G20, the ATACH group, and the way that France has pushed this through the G7 as well, against some opposition, I think it's fair to say, I think is hugely important. I would just give a call out. We realise this is a polarising issue. Anything we can do to bridge areas of work where it really matters on climate, where it has impacts on where mosquitoes fly, daily people's lives with other, maybe governments and others that don't agree so much with us, is crucial. We cannot allow the world to be completely fragmented. And then finally, as I've said a couple of times this week, it's a privilege to be in Lyon. It's a privilege to do my job, of course. It's a privilege to be able to come to these meetings. But the key is the responsibility that you take away from the privilege of being here. Not the warm words that we say, but the actions you take, I take over the next 12 months to commit to the work that we say we'll do here. Jerome, back to you. Thank you.
Thanks so much, Jeremy. I'll hand directly to the other co-organizer of this meeting, Vincent Breton from UNITAID.
Thank you very much, Diarmaid. Good morning, everyone. So my name is Vincent Breton, Director for Results and Climate at UNITAID. And I'll get the opportunity later in this meeting to speak a little bit more about the specifics of UNITAID's work in this space. But I first want to thank our co-host, so the Government of France and G7 Presidency, for hosting this event, and WHO as well. It's a great pleasure to do this together. And I'll be really quick, but I wanted to pick a few words from the title of this session that resonated a lot in the last few days here in the meetings in Lyon. One of those words is resilience. And I think in the context of One Health, we heard a lot about resilience and an encouragement to think differently. Resilience means anticipation. It means a focus on prevention. It means trying to prevent instead of curing, as the president of Ghana was saying. This is more cost-effective to prevent rather than to cure. So it's an encouragement as well to think across disciplines, because resilience is not just a matter of health verticals, it's a matter of how the different sectors will be able to work together. So I think that's a key word that can inspire our discussions in the next sessions. The second one is solution. I think there's lots of concrete solutions, and we've seen it this week in Lyon, that are coming from data systems, coming from technology, coming from innovation, coming from the private sector, coming from collaboration, coming from community-led innovation. And it's the time to have those solutions catalyzed and scale. I was struck by some of the words of the Economics Nobel Prize, Jean Tirole, in one of the sessions 2 days ago, saying that, yes, those innovations are important, but let's think about making those markets sustainable and viable. And many of them won't be sustainable if we don't have the right incentives in place. So incentives for the type of work that we want to see in terms of resilience and low carbon health systems. And finally, political momentum. I think it was very clear on Tuesday that there's strong political will at the highest level from heads of states, including President Macron and other heads of states, that multilateralism has a key role to play. The issues that we're going to talk about, that we've talked about for the last 2 days, cannot be solved by a single country alone, no matter which country we're talking about. I think this is the spirit of ATACH as well, and congratulations again, Maria, for all the work, and the UK as well for leading on setting up ATACH. This is such an important platform for collaboration. This is the spirit of COPS as well, of the Belém Health Action Plan, and it's going to be really important. So thanks a lot, and looking forward to the discussion.
So much, merci, Vincent. So that concludes the opening segment. I think you'll agree we're off to a fantastic start. I have to say I'm taking one message away from this. Having French worse than Diarmaid, I fear may become like a benchmark for future reference. So thanks to Jeremy for that. But I think we have that political context. It's very clear we have that high level political commitment, both within the more specific scope of climate change and health, but that broad umbrella of One Health, which is being championed by the French government, by the G7 countries and the WHO, and I'm sure UNITAID are so happy to support, but also that link between those high-level political commitments to translating that into the kinds of actions that actually make a concrete difference in people's lives every day. And that's basically what we're in the business of doing through the ATACH as a partnership, but also from the area of work that we lead specifically within WHO. And for me, that's the perfect segue to the next panel. So we will have interventions from several of our G7 countries and also from, I understand, the Brazilian presidency. So I would like to ask, if I may, representatives from Japan, also the UK, Canada and Brazil, if you'd like to come up to the front to make your interventions. I think we have enough chairs for you to take your positions. I understand some of you may have slides, some of you may not. This would also be another test of my language. So across those countries, I can do. The UK is easy for me. You're very welcome. Canada as well. You're welcome and bienvenue. Brazil, bem-vindo. Japan, you're also very welcome. So if I could ask the representatives of those countries to take your seats, please. And in the running order that I have, we have one participant online. Is that right? Canada online. Thank you. So I would ask you again, in my job of trying to keep people roughly on time for brief interventions, but we have asked the panelists to make that connection to concrete interventions that they are making progress on within their own countries, with a particular focus on integrated surveillance. But Masuko, you have the floor.
Thank you so much for having me. And then in Japanese, the very welcome is yokoso. Yokoso. So it's very easy to remember, right? And then again, bonjour, and then good morning, good afternoon, good evening to all participants in person and then online. I'd like to thank the government of France and then the WHO, ATACH, and the UNITAID, and then the Rockefeller Foundation to host this side event and then give me the opportunity to present here. My name is Masato Izutsu. I'm a senior coordinator for global health from the Ministry of Health of Japan. Today, I'd like to talk about the climate resilient and the low carbon health systems, drawing on the Japan's experience. Okay. So this presentation has two parts. First, I will briefly introduce Japan's disaster medical management system, how it was developed and how it works today. And then I will move on the measures to reduce the risk of the heat shock. I think that both topics are increasingly important as climate change puts a growing pressure on health systems. So before going into the detail about our policy and actions, let me give a brief background for the disaster management systems. First, geographically and environmentally, Japan has been highly exposed to natural disasters, including earthquakes, typhoons, heavy rainfall, landslides, and volcanic activities. As such, Japan has long prioritized disaster medical management. Second, major disasters such as the Great Hanshin earthquake in 1995 that mainly hit my hometown, Kobe, and the Great East Japan earthquake in 2011 revealed clear lessons about the need for fast medical response and the strong coordination and the maintenance of the health system during the disasters. Third, our rapidly aging population, that is approximately 30% of the population is aged 65 and over, and the regional disparities in medical resources add further complexity and during the emergencies. So against this backdrop, Ministry of Health has formulated disaster prevention business plan. Key components include disaster-based hospitals, DMAT, disaster medical assistance teams, disaster medical coordinators, and the BCP, business continuity planning. Key concept underlining these plans is rapid deployment and coordination. Together, these measures aim to ensure access to essential health service within first 48 hours after a disaster happening, and to maintain services beyond the acute phase. So disaster-based hospitals serve as the backbone of the system. They are required to have seismic reinforcement because in the first place, they need to protect themselves from the disaster to provide essential health services. And then emergency power generation, water supply systems, and the stockpiles of food, water, and medicines for at least 3 days. Many also have the helipads, specialized medical equipment, and training facilities. These investments not only support disaster, but also strengthen the resilience of the daily healthcare services. And this is about the DMAT, Disaster Medical Assistance Teams. DMATs are the specialized medical teams trained for the acute phase of the disasters. When local health systems are overwhelmed when in disaster, and it often happens, DMATs are rapidly dispatched to provide triage and emergency medical care, and then support overwhelmed hospitals, and transport and evacuate patients who need advanced care outside the affected area. Each team typically consists of the one doctor, 2 nurses, and 1 operation coordinator. As of 2025, nearly 19,000 medical professionals have been trained nationwide. Also, let me introduce the international cooperation. Japan also contributes to regional resilience through international cooperation. One example is the ATACH project, provided by the JICA, which supports disaster health management capacity in ASEAN countries. This project covers multiple activities. For example, the project conducts regional joint exercise where health and medical professionals from the ASEAN countries practiced how to work together during the large-scale disaster. Through joint training, simulation exercises, and policy dialogue, ARCH strengthens the coordination among health authorities and the emergency responders across ASEAN countries. This regional approach is essential as climate-related disasters affect multiple countries at the same time. So let me move to the next part, heat stroke prevention. So this shows the extreme heat. Extreme heat has become one of the most serious climate-related health risks in Japan, and it directly affects health system resilience, especially in aging society. The left graph shows the long-term trend in summer temperature in Japan, and then Japan recorded its hottest summer in 2025. And then the right graph shows the annual number of deaths due to the heat stroke in Japan. And this highlights a clear increase in recent years, particularly among older adults. So as temperature rises, both the number of heat stroke patients and the deaths have increased. So heat stroke is no longer a marginal issue. It has become a major public health challenge comparable to other natural disasters. And then this is a measure to reduce the risk of heat stroke. So one key measure is the heat stroke alert. The alert is to be issued when the heat index is predicted to reach dangerous levels. And how the heat index is produced is thanks to the WBGT monitor. It's shown in the right bottom photo. And then this may look like a special gadget from the sci-fi movies, but it's not. WBGT is a wet bulb globe temperature. So this can produce heat index considering not only temperature, but also the humidity, sunlight, and the wind. So this can produce more accurate index to predict the heat stroke. So field observation of WBGT and the clear risk communication support timely preventive actions. And also local government provide cooling shelters. Shelters are opened to the public during extreme heat. So equally important is the community outreach, including checking on the seniors living alone and encouraging appropriate use of air conditioning. So in conclusion, Japan's experience shows the climate-resilient health systems requires both structural preparedness for disasters and the proactive measures to emerging risks such as extreme heat. So thank you so much, and then merci beaucoup. ありがとうございました。
Thank you so much, Masuko, and thank you for making that transition to connections made to several of the points that were made in the opening presentation. So you have the political commitment, you have the combination of drivers, so that combination of demographics, for example, an aging population living in urban centers, increasingly exposed to heat, and then practical interventions, what you actually do about it to save people's lives, whether it's within, from emergencies or from heat stress, and the need for international cooperation and a regional approach and sharing lessons across countries, which is exactly what this is all about. So if I could pass the floor now to Daphne, please, from the UK, one of the parents, I would say, of the ATACH coming out of the COP in Glasgow. So over to you.
Thank you very much. Bonjour à tous. Good morning, good afternoon, and good evening to everyone in the room and online. So I'm Dr. Daphne Mosidou. I join you from the UK's Department of Health and Social Care. And I would like to open by thanking France and the organizers of this session for giving me this fantastic opportunity to address you all from this beautiful sunny day in Lyon. So thank you. Today, I want to share with you the UK's progress and ambition driving the transformation of our health system towards resilience and sustainability in the face of climate change. But first, we must recognize that the climate crisis is a global health crisis, already driving more frequent and severe health emergencies, from vector-borne disease outbreaks to heat stress and waterborne illnesses. It represents a major threat to human health and well-being in the UK, as it does in all parts of our world. The impacts of climate change are not experienced in isolation. They interact with and compound other shocks, threats, and trends, not only eroding health and health system resilience, but having a multiplier effect that expands beyond the health sector, threatening financial stability, prosperity, education, employment, and national security. Domestically, our commitment is to deliver the world's first net zero health service and respond to climate change, improving health now and importantly for future generations. This commitment was made in response to the evidence that climate change is no longer a distant threat, but it is already affecting the health and well-being of patients and communities across the country. We have set two targets for ourselves. The first one is to be net zero by 2040 for emissions the NHS directly controls. And the second is to be net zero by 2045 for emissions that the NHS influences. Whilst these targets are ambitious, we are delivering progress through actions that save money, improve health, drive growth, build a more sustainable healthcare service, and reduce emissions. This includes tripling NHS on-site solar generation with savings of up to £325 million, investing over £1.6 billion in energy efficiency and low-carbon heating solutions, phasing out desflurane, a high-carbon anesthetic gas, transitioning from all avoidable single-use medical technology products to a functioning circular system, reducing nitrous oxide waste while saving £2.3 million, improving respiratory care through inhaler optimization, and increasing the number of zero-emission vehicles in the NHS fleet from 1 in 100 to 1 in 10 since 2021. We are also taking action recognizing the need to tackle this problem from a supply chain angle. Our NHS supply chain is responsible for 62% of NHS emissions. To help our suppliers align with our own ambitions, we have set out clear steps in the Net Zero Supplier Roadmap. Some of the implemented milestones include requiring all NHS tenders to include a minimum 10% weighting for net zero and social value across all new NHS procurements, and requiring all new contracts worth above £5 million per annum to publish a carbon reduction plan for their UK Scope 1 and 2 emissions and a subset of Scope 3 emissions as a minimum. We remain steadfast in this commitment and consider it to be achievable despite the challenges. During the last 5 years, the NHS has not only seen emissions in the carbon footprint fall, but has seen that taking action offers wider benefits, including increased efficiencies across our infrastructure, improved patient care, financial savings, and an increased understanding of our carbon footprint. On an international level, it is clear how cooperation and knowledge sharing can help strengthen resilient and low-carbon health systems globally. We are proud to have taken a leadership role in ATACH, sharing learning on healthcare decarbonization and driving low-carbon, sustainable healthcare systems. This forum has fostered active, engaging dialogues, forged partnerships, and helped build capacity across the globe. One tangible example is the work of our National Health Service in leading the development of a pivotal report which provides health systems leaders and policymakers with practical actions for health systems to take in 2 crucial areas: optimizing demand usage and accelerating supplier decarbonization through sustainable procurement practices. This report, published by the WHO and ATACH under the title Decarbonizing the Healthcare Supply Chain, Strategic Actions for Health Systems, was unveiled at COP30. It stands as a testament to international collaboration being co-authored by NHS England, the WHO, and partners from Australia, Ireland, France, Germany, and Norway. Following in the footsteps of the NHS, around 45 countries have now set net zero targets for their healthcare systems, and approximately 90 nations have now committed to deliver low-carbon, sustainable health systems. This commitment demonstrates the momentum building within the sector and highlights the growing recognition that sustainability and health system resilience are deeply interconnected. We are proud that the NHS's experience and expertise are now helping shape policy and practice far beyond the UK's borders, demonstrating the value of knowledge exchange across the world. As we look ahead, we must continue to foster international collaboration, share knowledge, and innovate. The journey to resilient and low-carbon health systems is complex, but it is achievable. It is driven by a shared sense of purpose and responsibility, not only to those we serve today, but to future generations who will rely on the systems we build. Thank you. Merci beaucoup.
Thank you again for an absolutely fantastic intervention, again, bridging the international to the national and practical. And as somebody who comes originally from the UK, and I have to say it was a pivotal moment for us working on climate change and health at WHO, when we heard that the NHS, the largest single health system in the world, had made a commitment to be net zero. It's also one of the biggest employers in the world. It's a reference point, basically, for UK society. You know, my family in the UK, they use the NHS, they pay their taxes in the UK. And I have to say that the point that you were making, that not only is it decarbonizing, it's also ensuring high quality of service, ensuring resilience and saving money, is the kind of thing that's music to their ears, because it's actually building a better NHS as well as meeting our climate commitments for the future. So thank you again for that fantastic, concrete and important example. If I may check the online connection and check whether we have the connection. I'm getting a thumbs up from the back. So hopefully we have a long-standing colleague and friend and supporter from Health Canada, Carolyn Tateshi. Can I just check you're connected, Carolyn, and can hear us? Wonderful. Thank you, Canada. Thank you, Carolyn, and you have the floor.
Thank you, Dermot. Bonjour tout le monde. Je suis Caroline Tateshi, directrice du Bureau de changement climatique et de la santé à Santé Canada. Good morning for me and good afternoon to you folks there. I'm Caroline Tateshi. I'm Director of the Climate Change and Health Office at Health Canada, Canada's National Health Ministry. I'd like to first start by thanking France for raising this critically important issue, and thank you to all of our G7 partners who have been advocating for leadership in this area of climate and health. Certainly like to recognize, of course, our colleagues at the World Health Organization, a longstanding collaborator and valued partner for Canada. WHO's leadership and collaboration has been really instrumental in advancing climate and health action within globally, but helping us in Canada and in supporting that global learning and collaboration in this space. And Canada has been really pleased to collaborate and support action through WHO as well as the ATACH community, and thank our UK partners for helping initiate the ATACH initiative. Canada has been working at the intersection of climate change and health for more than 30 years now, and our Climate Change and Health Office had been established in the late 1990s. And over the time, we invested in research, monitoring, risk assessment, and adaptation efforts. And sadly, what we're seeing today is that many of the projections that we as a scientific and global community were examining decades ago have become reality, and often faster and more intensely than projected. This is one case where we might have wished that we had been wrong about our projections and our work, but sadly we have been not. And that makes the need to rapidly accelerate our action even more critical. Canada is warming at twice the global average, and the north of our country is warming at nearly 4 times the global rate. As a result, we are experiencing a broad and growing range of climate-related health hazards, including more frequent and extreme heat events, wildfires, deteriorating air quality, flooding and damage to our critical infrastructure, including health infrastructure, and the spread of climate-sensitive infectious diseases such as Lyme disease. As in other countries, the health impacts of these hazards have not been felt equally. And Indigenous peoples, older adults, women, people with chronic health conditions, children, people who work outdoors, and those with lower incomes have been disproportionately affected. At the same time, climate impacts are placing significant strain on our health systems themselves, damaging infrastructure, disrupting supply chains, and increasing pressure on an already stretched health workforce, and threatening equitable access to care. And this is why we see adapting health systems to climate change as really essential. As our colleagues in Japan have highlighted, extreme heat is becoming an even more serious issue, including in Canada. Well, Canada has been historically known as a cold country, and it means that our society is well adapted to the effects of extreme cold, but unfortunately not for heat. And addressing this challenge demands a need for an intersectoral approach with health system resilience. And this is tragically demonstrated during Canada's 2021 heat dome event, where there was a very extreme heat wave in the western part of our country, where temperatures reached nearly 50 degrees Celsius, completely unprecedented temperatures. During this event, more than 600 people died. The deaths were overwhelmingly amongst seniors and people living with chronic mental health conditions such as schizophrenia, and nearly all of these deaths occurred indoors. So this was not simply a challenge of the health sector and could not have been addressed by the health sector alone. The heat dome revealed how health risks are being shaped by the interconnected factors such as housing quality and building design, access to cooling and energy, social isolation and income, and urban planning and emergency preparedness. And it underscored the importance of better coordination across these sectors, having the ability to identify who's most at risk, where they live, and what interventions are needed before the emergencies escalate. And it also reinforced a critical lesson. that climate resilient health systems must extend far beyond the hospitals and the clinics and must be supported by collaboration across housing, energy, infrastructure, social services, emergency management, and amongst many other sectors. So what is Canada doing? Canada is taking a systems-wide approach to adapting health systems to climate change, recognizing that resilience must be strengthened across all aspects of the system. Our efforts are anchored in Canada's National Adaptation Strategy, which outlines a whole of society priorities and includes health and well-being as a dedicated part of the strategy, which puts health at the core of the center of Canada's action to adapt. Key objectives are to minimize climate-related health risks, better prepare health systems for increasing and shifting demands, and strengthening equity and protecting those most at risk. And because health systems in Canada are decentralized, the federal government works closely with our colleagues at subnational level, our provincial, territorial, and local health authorities to implement these objectives, and demonstrating the need for such great collaboration, not only across sectors, but also integrated within our governance systems. A cornerstone of this collaboration is Health Canada's Health Adapt program, which provides funding, leadership, information, and scientific research to support projects led by our provincial, regional, and local health authorities across our country. Our Health Adapt program is particularly important because it supports locally driven solutions tailored to regional risks and needs, enables our climate health vulnerability and adaptation assessments, strengthening the evidence base for decision making, and builds capacity within the health authorities to plan for and respond to the climate hazards. It also encourages collaboration with Indigenous partners, other sectors, and ensuring that community voices are a part of the climate adaptation planning. By grounding adaptation efforts in these local evidence and lived realities, Health Adapt helps ensure that actions are practical, effective, and focused on those most at risk. An important part of the Health Adapt program is also our community of practice, which allows for the learning across each of these projects and across our country, and also connects us into the ATACH initiative so that we can bring those global learnings back into Canada. And while we continue to advance efforts there, we're also working to address the extreme heat risk that I spoke about earlier. It remains the deadliest climate-related hazard in Canada. And we are working to fund research to better understand heat health risks, particularly indoor heat exposure amongst seniors and people with chronic conditions, supporting our heat alert and response systems, which enable earlier and more targeted protective actions, and providing financial and technical support to provinces, territories, and researchers to develop provincial-wide heat response plans, as well as local adaptation measures. And these efforts are helping to reduce preventable illness and death, support more effective use of the health system resources, and reduce pressure on emergency departments during extreme events. They also demonstrate the value of linking health with efforts across the different sectors. Canada is also strengthening how we measure progress and learn from experience. We are working to develop a monitoring and evaluation framework under our national adaptation strategy to track progress and strengthen health system resilience and advance equity. And we are also drawing lessons from Health Adapt to better understand what has worked well, where challenges remain, and how we can scale successful approaches rapidly across regions and community. Despite all these efforts, we know that incremental adaptation is not keeping pace with accelerated climate risks, and to respond effectively, we must scale up proven interventions much more quickly, strengthen this intersectoral collaboration, embedding health considerations across climate-relevant sectors, continue to build capacity within the health workforce, and better articulate adaptation as a smart investment that it saves lives and avoids future costs. In support of some of these goals, Canada in the fall had partnered with the WHO, Columbia University, the Global Consortium for Climate and Health Education to develop a course on scaling up health adaptation measures to meet the climate challenges in the Americas, as just one effort to try to share information and advance this work. Climate change is a global challenge, and continued collaboration is essential. Canada greatly values the G7 as a platform for dialogue and shared learning, and we commend initiatives such as today's event, which provides an important framework and opportunity for strengthening health system resilience. And we continue to strongly support ATACH as a space for countries to share our experiences, challenges, and solutions in real time. Canada's experience, including the tragic lessons of our 2021 heat dome, has made one thing clear, that protecting health in a changing climate requires climate-resilient health systems supported by strong intersectoral action. And when we get this right, we can, as Diarmaid and our colleagues from the UK have mentioned, achieve 3 outcomes: improve health and patient outcomes, use limited resources more effectively and save money, and better prepare for the climate risks that we know that are already here. Canada looks forward to continuing to work with each of you to accelerate this action because the pace of climate change demands nothing less. And in closing, I'd like to once again thank France for elevating this important issue and for the leadership in advancing climate and health discussions. And Canada looks forward to continuing to work with our partners through the G7 and ATACH, strengthening collaboration, sharing lessons learned, and accelerating action to build more resilient health systems for the future. Thank you very much. Merci beaucoup.
Brilliant. Thanks so much, Caroline. Also, thanks for joining at a very unsociable hour in Canada. Very kind of you. It's customary Canadian politeness, I think, to join at that time. And also, thank you so much for the substance of the remarks. I remember when I turned up in WHO to start working on climate change and health over 20 years ago, there was already a joint report by WHO and Health Canada on climate change and health. So thank you for staying the course. And also, I think those very concrete examples from, again, a country that we would expect to be less vulnerable to the health impacts of climate change, one of the best health systems in the world, not the hottest place in the world, and yet still there are vulnerabilities that need to be addressed, particularly in particular communities. So thanks again for your work and also for bringing that to this international forum and sharing those experiences. So if I could hand for the final intervention on this panel to the colleague from Ministry of Health, Brazil. Brazil also the current president of the Climate Change COP, the host of the recent Conference of the Parties in Belém, and the champion of the Belém Health Action Plan. So you have the floor.
Thank you. You hear me well? Okay. Thank you very much. I'm Camila Mando, General Coordinator at the International Affairs Office at the Ministry of Health of Brazil. On behalf of my ministry, I'm honored to take the floor in this presentation. I'd like to bring some practical insights of the Belém Health Action Plan, which is at the core of the Brazilian presidents for COP30. According to Ambassador Correa do Lago, we must move forward from commitments and speech and all to implementation. So this is the kind of things, some highlights, some insights that I want to bring to all of you today. Well, as highlighted at the One Health Summit, a One Health approach is essential to address interconnected challenges such as pandemics and climate change, one of the defining threats to global health in the century, as highlighted already at this panel today. Climate change is already placing increasing pressure on health systems worldwide. It is reshaping disease patterns, increasing zoonotic risks, accelerating antimicrobial resistance, and affecting the environmental foundations of health. These dynamics reinforce the interdependence between human, animal, and environmental health. At the risk of repeating myself, but still with the idea to stress what's really important here. Brazil, therefore, sees climate resilient health systems as a practical and scalable entry point to advance One Health. The Belém Health Action Plan for the adaptation of the health sector to climate change responds to this need. It is a voluntary, flexible, and action-oriented framework endorsed already by over 30 countries and 50 organizations, including several G7 members, and I thank you for that. The plan is structured around 3 lines of action: climate integrated surveillance, evidence-based policies, and capacity building, and innovation, production, and digital health. It also recognized that climate action must not deepen inequalities. On integrated surveillance, Brazil emphasizes systems that combine environmental, meteorological, and epidemiological data to detect zoonotic spillover, climate-sensitive disease, and the impacts of extreme weather in real time. The plan promotes early warning systems, cross-border data sharing, and the inclusion of local and indigenous knowledge. These are operational priorities already being advanced with WHO and ATACH partners. The plan also encourages multi-sectoral cooperation to strengthen food safety, address antimicrobial resistance, control zoonosis, and enhance pandemic preparedness and response. Importantly, it highlights continuous evaluation and adaptation of surveillance systems to capture both acute events and long-term climate impacts, supporting timely, evidence-based action. These priorities are reflected in Brazil's also National Adaptation Strategy, AdaptaSUS. Brazil looks forward to deepening cooperation with ATACH members and in implementing the Belém Plan and advancing One Health. Finally, I would like to invite you all, your governments, to a World Health Assembly side event, the Belém Health Action Plan from COP30 to COP31. Invitations will be shared shortly through your permanent missions in Geneva. To the event, I think it's planned by May 18th, if I'm not mistaken. We look forward for your participation. I thank you very much. Muito obrigada.
Muito obrigado, and thank you again for a fantastic intervention. And I have to say, those of us who work on climate change and health, you've probably heard we have a lot of plans. We have the Global Action Plan, we have the Belém Health Action Plan, but we work very hard to make sure that these are aligned, and so that what is endorsed through the G7 or through the G20 or through the World Health Assembly or through the Belém Health Action Plan is actually mutually reinforcing. The other thing that I think we particularly welcome from your intervention is we've been saying we welcome the fact the emphasis is on the action. It's got plans are good, but the actions are what's important. And so that's also what we've been working with the Brazilian government to drive forward. The final thing I would say is we really welcome the fact that as the presidency moves around for the climate change COP, health is now a constant, and we really thank Brazil for keeping it high on the agenda. And also each new presidency brings something new, brings a new emphasis. And the emphasis that Brazil has put on equity and fairness is one of the things that we've really appreciated being stressed within the agenda this year. So thank you again. Muito obrigado. And with that concludes the first panel. Unless my bosses at the back tell me different, then please a round of applause for this. And I will welcome the next panel to the stage. So I see Mauro Moraes from the Climate and Health Lab, the Institute Pasteur São Paulo, also Dr. Maria Neira, and also Kate Ndoko, so the Youth Ambassador for France and WHO Youth Council representative. So just before I hand over to Mauro Moraes, working at the Institut Pasteur, but in Brazil, and also speaking perfect English. So I've heard the English, the French, and the Portuguese. And then I was really embarrassed when Mauro met the delegate from Masuko from Japan, also Japanese as well. It's really making the rest of us look bad. Another aside, that now brings us up to 2 judo black belts that we've had on the panel so far this morning. Maria generally needs no introduction. She has been introduced several times as now formally an ATACH champion. She was generally just an all-purpose champion, also for the ATACH, but now I'm really pleased that the countries of that constitute the ATACH have formally given you the title. Basically, just put the crown on your head. And also, really a pleasure to welcome Kate Ndoku. I would say that again, the time that we've been working on climate change and health, the younger representatives, whether it's the International Federation of Medical Students Associations or the young doctors or young health professionals which have come through the system, have been a consistent and revolving conveyor belt of champions basically on climate change and health, because basically they see this as the future that they need to face. We're running just slightly behind time, not hugely behind time, but I will ask people to try and keep us time as much as possible. So I'll stop talking and hand directly to Dr. Mahais.
Hello. Good morning, everyone. Thank you so much for coming. I want to say also thank you for the Ministry of Health of France for bringing me here. Of course, WHO and ATACH and all its partners for getting us together here. So I would like to just start with the first slide for you, and I'll keep it on the first slide because, okay, I want to start asking you, when you wake up in the morning and you look at this image through your window, what do you think? Should you go out or are you going to stay at home? Do you need your umbrella, your coat? Are you wearing boots? But the thing is that this is something that you're doing. What you're doing is you're preparing for the weather to come, right? So this is what this project is about. It's about preparedness. So the major question that we are driving here is, are we ready for the next pandemic? Are we ready? Are we prepared for an outbreak? And what I've been working exactly as an epidemiologist at Instituto Pasteur de São Paulo is to leverage climate data to healthcare professionals or the public health practitioners in São Paulo to understand how we can use the climate and environmental data to predict the diseases that are accounting in the tropical regions. The challenge is, and I want you to take a look on the image on the left side, it's exactly because when we look at climate data, this is what we are seeing, right? It's spread around. Different agencies works with different data centers. So harmonizing all this data is actually a scientific challenge. And I mean, harmonizing this with the health data. So next, please. And to give you a little bit of context within the climate and health nexus, this is the amount of money we have been spending in the past. But I want you to take a good look that the scale of these numbers, it's US dollars, is really different. Okay, it's if you look at it, the scale of trillions opposed to billions in the climate sector. So there is an opportunity here for investment that will improve our quality of life through health, right? So, and next, so what exactly is this climate and health nexus that requires investment? In one side of the coin, we have the health impact on climate. Of course, health systems cost a lot of money. They require a lot of energy to operate. They require water supply to operate. They also generate residues that are really complex to deal with, like needles or those hospital equipments that become obsolete. And in the other side of the coin, next slide. So the other side is exactly the climate impacts on health, which I think it's where the One Health approach gets most of its benefits. We know that climate change is causing the diseases to reach higher latitudes. We have seen dengue cases in Paris. We have seen extreme weather events more and more frequent and more intense. And finally, now there is us. the enablers or the facilitators of this process that are participating on this. We have lawyers, we have doctors, physicians, public health practitioners, teachers, professors. We are all involved in this process to better understand what's going on and to find collective solutions for this problem. Studies, and then I ask you to go next. I don't have the control with me, sorry. So many studies have been demonstrated how hard it is to connect climate change or so-called climate anomalies through to the health outcomes we have. The challenge is huge because we have the time lag between the climate event and the health outcome that we are measuring, right? So for some disease, it's kind of like seasonal pattern, and we can actually predict what is going on. But for others, especially when we talk of climate-sensitive vector-borne disease, are much more harder to identify which was the climate event that triggered the process. So our idea is to use climate data as a proxy or as an indicator of the health outcome. Next slide, please. So, which brings us to the question, where is going to happen? Well, we've been drawing maps to identify high-risk zones of those issues. So this is a very new, recent publication about this that we mapped, and I mean humans, we identified, and Brazil is no exception, right? Brazil is a very big country, tropical country, and you can, it's down in the bottom left, that we see that it's a continental country, mostly in a tropical region. And it contains areas of high risk, taking into consideration the interface of humans with forests, and also taking into consideration of socio-economic conditions of those people, if they have access to clean water, wastewater removal, access to or the distance to a public health facility that will be able to notify the cases in time before the pandemic occurs. So all of these factors, or let me say drivers, are making part for us to estimate this risk. And next. So as I mentioned, next please. I think you quit the presentation mode. Well, Brazil is, of course, no exception for this problem. It's a continental country. We are organized in states and we are organized in regions of the country, but I'm highlighting here our biomes. Brazil is composed of 6 biomes plus 1 marine biome that it's also affected by the climate change. And the Institut Pasteur in São Paulo have put up its efforts to monitor and emerging and re-emerging viruses in the tropical regions. So we have many groups working now in different aspects of the One Health approach. Specifically, I can say that we have bioinformatics, genomic surveillance is now going on. We also have vaccinology, systems vaccinology. We are working also on surveillance of bats, birds, and urban rats as a source of zoonotic disease. And down here is exactly where I work in the climate and health section of our unit, which I am currently using the climate factors as drivers for American cutaneous leishmaniasis in the Amazonia region, the yellow fever cases we have had in the southeast region of the country, and of course, dengue in the municipality of the city of São Paulo, which is a very big city with more than 10 million of people that might be exposed to these problems. And I want to change to the last slide. And finally, I want to say thank you for all of you to listen to me. I want to say thank you to the Rockefeller Foundation and the Institute of Philanthropy of Hong Kong in a partnership with the Pasteur Network that is sponsoring my project, and all my climate and health fellows in Pasteur Network. I would like invite you to scan this code if you have questions specific for more specificity on the yellow fever project. I'll be happy to answer later, and I'll be happy to answer, actually, try to answer all your questions about how we are doing there. Thank you very much.
Thank you so much, Mauro. Again, a fascinating presentation. The one big message I took from this is it's big and it's complicated. The agenda is absolutely huge.
Small mosquitoes, big problems.
Exactly. Small mosquitoes, big problems, but also you don't have to do that on your own. You have a big network which can cover the whole agenda, and that's the philosophy basically that's behind everything I think that we're trying to achieve. So it's a pleasure now to hand over to Maria. I think maybe we've all just assumed Maria needs no introduction, but for those few people in the world who may not have met Maria before, formerly my boss, formerly the director of the department responsible under different names for all environment, climate change and health work at WHO and many other things beside. And given that this session is it's titled an intergenerational dialogue on climate resilience and low carbon health systems, I'll introduce you as the permanently young doctor who has huge experience on this issue. And Maria was asking, well, what do you want me to say? How is this session how's it going to go? I'm just going to hand you the mic, Maria, because we know how this works. But to give us basically your perspectives, on this area of work and what you see as the future of where we should go from here. Over to you, Maria.
Thank you so much, Diarmid. Bonjour tout le monde. Bien sûr, merci la France pour cette grandeur, encore une fois, que vous avez montré dans cet endroit si particulier. It's really a great privilege to be here, and thank you very much, Diarmid, for your nice words. Thank you, Jeremy, as well, and all of you for mentioning what this passionate work has been for many years now. The good thing of participating on an intergenerational panel is that we will keep the mystery. You will never know who represents the youth and who represents the other one. It's up to you to speculate, but it's up to you. I'm not giving details of that. We can say that so many things, so many good things about ATACH. We will be permanently grateful to UK for putting light in that terrible COP in Glasgow, terrible in the sense that we were wearing masks and all of that. And we will permanently be grateful to all the countries who supported after that. I don't need to mention all the COPs and all of that. So we can focus on that positive achievements, Diarmid, on how ATACH started with a very small group of countries, how many countries we have now, how many communities of knowledge and practice. But we need to focus as well on, we achieve a lot, but we are now in such a geopolitical situation. Jeremy was referring to a particularly challenging political situation where we need to be faster and we need to be more ambitious on what we deliver. No way to go back. We need to make sure that our health systems are resilient. No way to discuss about that. You can have the political environment that you want, but our health systems must be resilient. No other choice. You hear it from Brazil, you hear it from all the countries, from Japan, presenting, no matter what, our health system has to be resilient to climate change. And then we need to achieve low carbon. And I think all of those priorities and very concrete projects presented here today demonstrated something that is extremely important. Not only is good for health, and I think we need to insist very much that this is good for the economy. And I'm afraid this is an argument that will mobilize maybe even more than what other arguments we have been using. Diarmid and many others here in this room, we have been for years using that. We started saying climate crisis is a health crisis. And we provide all the evidence on how climate change was affecting our health. Then we moved to something a little bit more positive, saying, well, all the climate treaties can be the best, the most powerful, the most incredible and ambitious public health treaties. Then we say the price is paid by our lungs, and we were putting our lungs there, our health at the center of the negotiations to remind everybody that this was a question of health among everything. And then we move to the next step where we say, okay, there are health arguments to motivate more climate action. To end up with health is the argument. And I think health is the argument. And because we have this challenging political situation, to call it on a very nice way, we need to demonstrate how health will be benefited if we put in place all of these strategies that ATACH is trying to deliver. If we start by the end, we see today small hospitals around the world, from Peru to Europe to any place around the world, small hospitals saying, how can I reduce my carbon footprint? And it's not a luxury at all. It's a real and clear necessity. You need to look at the procurement and the supplies, and on this, the private sector needs to play a big, big role. If one big company decided, pharmaceutical company, change the packaging of one drug, imagine at the end of the chain how many millions of plastic we are reducing, and how this will be impacting positively on the health system. We need to look at the care we provide to our patients. Of course, not compromising at all the quality of the care we provide, at the contrary, but telling people that changing inhalers, for instance, or changing the anesthetics might have a triple win, not only for reducing the carbon footprint, but to reduce the cost and to even improve the quality of the care we are providing to our patients. And of course, the third one is telemedicine and digital medicine, which is irreversible and growing on an incredibly exponential way. So those are the type of examples, the concrete, the pragmatic solutions we need to present on a very strong way at the COP30, at the COP31, any event we have, putting there on the table all of those arguments, concrete solutions, and demonstrating that the health professionals, the health sector is moving no matter what, and we are even moving on a different speed and demonstrating concretely on a very tangible way what can do at the health sector. I'm sure that the young will do that with a lot of enthusiasm, and I see young doctors now not questioning at all whether we need to do something on climate change and health or not. At the contrary, proactively engaging and moving and demonstrating that this is something that, as I say, is irreversible in no way. So this is a very proud champion of ATACH. Champion, I don't know why, because I didn't do anything yet, but I will try to do my best on providing and stimulating. But I'm very, very proud, and thank you very much. Jeremy, last point, you mentioned that we have been moving mountains in WHO on climate change and health. Thank you very much. But I still remember a conversation with you on your role as Wellcome Trust, and on the corridor in the cafe, and you were telling me, after several discussions, that Wellcome Trust will be investing on two priorities, mental health and climate change. So thanks to that as well, we could move that mountains that we are now pushing and hopefully creating the one with the snow on the top and beauty as well that will motivate all of us. Thank you, dear mate. Is that okay, or yeah?
What can I say, Maria? Good. Thank you. Yes. Thanks. And well, with respect to the other panelists, I'm going to hand over to possibly the most important person on the panel, because as I say, you know, we have seen the young generation of health professionals come through as champions on this issue. And I do wonder, when we see a new champion arriving, how you view the future. Basically, you know, is it intimidated? Is it, you know, worried about what's coming down the line? Do you see it as an opportunity, as a challenge? So I'm not a doctor, but how are you feeling today?
Thank you so much, Taramit. I think your question is very interesting in the sense that we of course, ATACH is an evidence-based network, and it's very important to have scientific generation and scientific evidence to guide our processes. But climate is so much more than that. It's also very much an emotional issue. It's an emotional thing, and this is why we started the Congress with the production of films and mini short films that were projected in the context of the Health for All Festival by WHO. So your question about how am I feeling, I would say I'm feeling hopeful. Which is something that is not necessarily associated with my generation. 60% of youth right now is experiencing in any way, shape, or form eco-anxiety. It's our main feeling toward climate. But I'm feeling hopeful because throughout the week and throughout the past few days, I've seen commitments. I've seen financial commitments from the different member states. I've seen commitments from funders, public banks, but also from the Wellcome Trust. I'm very fortunate to have been working with colleagues from the WHO country office in Georgia. And there is financial and funding that is being incremented on the topic of climate change. So I feel hopeful. However, I will use actually your words, Maria, that you told me 2 years ago. I don't know if you remember, but it was at the moment when we were launching the declaration, the WHO Youth Council Declaration on Creating Healthy Societies. And Maria, she jumped on us. We've always heard the same energy that she always had, and she said, "Be the Che Guevara of climate change," which is extremely enthusiastic and extremely, it gives you hope, it gives you energy when she says that, but it also gives you an understanding as to all the moving pieces that need to work together. Because Che Guevara, he started as a medical student. And then afterward, he entered the work that we know in the policy world. But as a medical student right now, we don't have the rightful tools for education, for climate change education. There is a lot of work that is being done by the WHO Youth Council on mapping how many curricula already have climate change integrated into medical schools, and there's only 15%. So it means that 85% of the medical schools right now do not have climate change integrated. The proportion of that is even smaller when we're talking about One Health, so it's not present. And when we're talking about integration of climate change into curricula, what do we concretely mean is that the medical students of today, which are going to be the practitioners and the clinicians of tomorrow, they need to understand that everything that is happening, the underlying factors that are going to, for example, affect the respiratory diseases that their patients are presenting with, is interlinked with the environmental factors. It's interlinked with the trees that are right at the window panes of the same patients. It's interlinked with the air pollution, the indoor pollution, the outdoor pollution, the PM 2.5, the PM5 levels that these patients are breathing on a day-to-day basis. But it's also interlinked with not just the problems, but also the solutions. And I think what I've really liked during the past few days is that we have been talking about solutions. And if your clinicians are not thinking about environment and the link between environmental health, they're not thinking about nature-based solutions. When they're going to think about the person that is coming up with high blood pressure, they're not going to think about exposure to nature as a solution or as a medication. And Maria was mentioning also the impact that supply chain and medicines has on greenhouse gases emissions. On this one, exposure to nature, going into the forest, going into a park for a walk, it is not producing any kind of emissions. It is free of emissions, it is carbon neutral, it's net neutral. And those are all solutions that need to be in the minds of the clinicians whenever they see the patients going into the clinic for care. And I think Jeremy also was mentioning before the importance of community engagement. And this is where I think a lot of the time we think about education as a top-down approach, but it's also very much important to have this bottom-up approach in our minds and in our midst. And I've been very fortunate to have several conversations with Dr. Serge Morin, which is a professor that for the past 40 years in France has been working on environmental health and One Health, and he's currently working in Thailand. And he did an experiment. He asked children that were no taller or no older than 5 to 7 years old if they could identify the plants that were in their surrounding. Can you guess, a rough guess on how many plants could this 5, 7-year-old could identify? More. How many? More. 200s, between 100 and 200s. And the reason why they couldn't identify necessarily the name, but they could identify the usage. They could say, this is the plant that my mother is using for cooking. This is a plant that my mother is using when I have a fever. This is a plant that she's using in order to maybe patch up my wound. And this is where traditional indigenous knowledge from the younger levels is extremely important to keep and to capitalize on, because these are going to be people that will use this healthcare system, and whenever they're going to maybe have health issues, anxiety, trouble sleeping, instead of going to the doctor and saying, please, can you give me a medicine that we will have come from different countries and we'll have, again, increased our greenhouse gases emission, they might say, no, I don't need that, mommy. I might just need lavender. I might just need lemongrass. And all those knowledges, they need to be capitalized on. There is knowledge that youth has. I've been very fortunate on the 6th for the one that have been able to participate to present our youth declaration for One Health, for youth integration into the One Health approach. It has been co-constructed by 15 young youth organizations, people that are from 18 to 35. We have one of our colleague, Lorraine Monjean, who's in the room right now. So youth has expertise, communities have expertise. We need to capitalize on that. We need to utilize that. And sometimes we need to learn from them, because they're actually our biggest teachers.
Brilliant, fantastic. Thanks so much once again. Just looking at the time, I see that we have one more panel session. Then we have a session in which Jérôme and I will be summing up. I will not be saying very much. So I think in terms of the time, we could take a little bit more, just a little bit more time on this panel before we hand to the other panel, but not too much. So I'll just give a quick bit of advance warning. I'm going to come back to the panelists to ask you just for 1 minute to give advice that you might give to the ATACH and to the champions of the ATACH, which are represented in this room. But I'll give you a couple of seconds to think about it, just because just to appreciate Kate Ndoku's comments, because again, I think they sum up some really important things for us. That the attitude towards this issue, because it is easy to say it's complicated, it's big, it's negative, you know, to despair. And the thing that we see from the younger generation is not giving into that despair, just to have the attitude of focusing on the solutions and things that we can actually do about it. I sometimes refer to the youth participants as our source of renewable energy, because we get a new one every couple of years and they're always really, really positive. I also think that championing from the younger generation, you were referring to climate change on medical curricula. The International Federation of Medical Students Associations a few years ago was basically grading the medical curricula from around the world, saying this university gets a C because they've got some climate change. This one gets an A because they're positive about it. This one gets an E because they don't have climate change on the curriculum. I think taking that responsibility is absolutely fantastic. And again, that focus on solutions, but a broader view of solutions. It's not just individual clinical interventions. It's looking at the determinants of health, critically important. So if I can start doing that roundup back, again, 1 minute, and over to you, Mauro.
Build bridges, because we have to gather knowledge from other sectors, from other, and see other perspectives. The local communities, indigenous populations, and so on. We need to understand their local needs so we can provide better healthcare, or what can we learn from them that will help us solve a problem that belongs to us all.
Well, first of all, I have to say that I'm very pleased to see this Che Guevara growing. A good Che Guevara, not the guerrillero one. That one, no, please. And the good one at the beginning, when he was a medical doctor, and then he was going around to treat tuberculosis and changing the social conditions of the people. Well done. Dear me, 2 messages. One, please focus on the achievements, on the tangibles, and share that knowledge, the bridges you were talking about. ATACH is very rich now in knowledge. So imagine that a pediatrician in a very isolated hospital somewhere decided to move into this, they need to have access to this information, the knowledge that has been generated in terms of carbon zero, net, on supplies, on the procurement, on telemedicine, where knowledge can be shared very, very quickly and keep this healthy competition between countries. I think it's very, very healthy to put into positive competition Japan with UK, with all the countries, and France, of course, and see who is achieving more at the end of the year. This is a very healthy competition, and the more we can demonstrate that the results, the tangible projects, and the concrete reduction on the carbon footprint and the savings for the economy of the hospital or the health system, the better. Thank you.
To build up on that, actually, on a few words, I think one thing is to not envision climate resilient healthcare system as an add-on, because, for example, from my work in Georgia, for those who know, there is 2 regions that are currently in a kind of humanitarian settings, that is in Georgia. But when I was talking to the colleague who's working there with UNICEF, because there is a project that is on renovation of healthcare facilities, and I told her, how about when we're thinking about renovation of healthcare facilities, we also integrate a climate resilient component. When we're thinking about the energy efficiency, when they're thinking about the ventilation, we also integrate that climate resilient component. And what she responded to me, she paused, because of course it was really surprising, because we're thinking about primary healthcare, we're thinking about vaccination levels. And she said, please tell me more. And I think those 4 words kind of really summarize the whole approach. It's about providing solutions that work in different settings, even in the lowest settings, not just in the high income settings, but even in humanitarian settings. How does ATACH provide expertise and support to all those, to all those who want to participate? And I think that the second point is, to respond to your first question, you were asking me how I was feeling. I'm feeling hopeful, but to keep that hope ongoing with the youth, I think there is a component that needs to be about accountability. I'm 28 years old, which is considered young, but I think if you ask my niece, who's 12 years old, she would say that I'm ancient. But in this short lifespan, there has been so many commitments. We have the Belém Action Plan, we have the Kyoto Protocol, and so on and so forth. So whenever there is these protocols or treaties or agreement that comes in place, there is hope that is sparked among the young people. But whenever there is afterwards recalibration of these treaties or recalibration of the targets, when we go from 1.5 degrees to 2.5, that hope is a bit shattered. So if I have maybe one message for ATACH and for the member states, it's about maintaining this accountability so that we don't lose the hope.
Wonderful. That's the perfect note to finish the panel. Thank you very much. You've had your round of applause, but thank you once again. Have another one. So with that, I'd like to move to the final panel session. And I know we have some participants in the room. I think some at least connected online. So Vincent, please, again from UNITAID. I know we have the Lancet Countdown. We have Marina Romanello online. I believe we have representatives from Australia, South Korea, and Germany. And I can't remember who we have online and who we have. Okay, just Germany online. Okay, so we should have representative from Australia. Okay, right. So therefore, I think I think we can then start. And this final panel is entitled From Evidence to Action, Accelerating Healthy Climate Action in All Sectors to Support a One Health Approach. It's a long title, but again, perhaps we can make this as concrete as possible. And I know that UNITAID is, again, one of our longest standing partners with WHO and with the ATACH, has very concrete actions within your sphere of influence. So I'll hand the mic to you, Vincent.
Thank you. Thank you very much, Dermed. And indeed, what I'll try to do is start from the Belém Health Action Plan, which we heard about from our Brazilian colleagues earlier today, and focus on the 3rd pillar of the Belém Health Action Plan. The 3rd pillar is about innovation and production. And I want to insist that this is really first of all, something that the Belém Health Action Plan has brought to the forefront, which wasn't as prominent in previous policies, and that's a great step and a critical component of climate adaptation. So I want you to think about those types of issues that any country could face that have in common to be climate-related, health-related. Things like not having a treatment for an emerging vector-borne disease. And we heard about dengue for those who were part of the G7 discussions yesterday. Having health products that are too difficult to administer for populations affected by climate change that may be, for instance, displaced. Not having the right products, not having access to products because, for instance, a facility somewhere in the world has been flooded by an extreme climate event and the production is stalled and we have a stock out. Having products that degrade because of high temperatures, or having products that are too high in terms of carbon content. Those are all issues that are related to this third pillar of the Belém Health Action Plan. They all happen already. There's plenty of examples for each of those categories of that happening in different parts of the world. And they all have in common that they exacerbate inequities in terms of access to health. And what I'll try to do is illustrate the types of solutions, because we're focusing on solutions, that are available already now or could become available to solve some of those problems. First of all, when you think about vector control, there's been a lot of work over the last few decades to improve the tools, and this is continuing. There's a very strong pipeline of new tools for vector control, like the piece of plastic that you see here. It's called spatial emanators. It contains a product that diffuses progressively into the atmosphere, something you can hang in the room of a household, in the different rooms, and it protects against malaria transmission during the entire day, contrary to a bed net where you get protection only during the night. It's also something that potentially, and this is a study that we still need to do, but potentially could be used for dengue. So you see a lot of climate sensitive disease could be benefiting from a solution like this, including in settings like displaced populations, refugee camps, where using a bed net, for instance, is not practical and feasible. Another example is in terms of administration. Some treatments that are needed, for instance, in HIV, in TB, in hepatitis, require taking a daily pill for several months, if not for life. And that might be challenging for populations that are in fragile settings, that are in places affected by extreme events, or again, displaced populations. There are incredibly powerful innovations coming in the pipeline. Many of you would be familiar with lenacapavir, HIV prevention treatment, which is 100% effective, provides 6 months of protection with a single injection. And of course, a lot of benefits when you look at it from a health perspective, but what we're saying here is we should look at this also as a climate resilience, a climate adaptation solution because of the settings where it can be used. Third, and if you take a step back and look at not just at the products, but supply chains, we've heard about the last months, the last days, a lot about regional production, the importance of having more sovereignty in terms of manufacturing of products. Again, if you look at this from the perspective of climate resilience, this is a very important solution. What you see on this map, for instance, is where a few years ago, malaria prevention treatments were manufactured, India and China, and essentially being used in Africa. With the support of UNITED, we now have 2 manufacturers in Nigeria, 1 in Kenya. So we're closer to the market. We have a more diversified network of manufacturers, less susceptible of supply disruption, and shorter logistical routes. So again, a climate adaptation, a climate resilience solution that we have right in front of us. Speaking of supply chains, we heard from several G7 members earlier in this session about the impact of heat on populations, on people. But heat has an impact on products as well. Many of you maybe have medicines in your bag right now. Most medicines are designed for room temperature. Room temperature means maximum 30 degrees Celsius. Many parts of the world, 30 degrees Celsius is not the reality. The data that you see represented here is data from a study from a few years ago conducted by Chemonix, looking at a shipment of treatments from Southeast Asia to Southern Africa. 92 days of travel for the medicines on a boat, essentially, on a container, and then getting to the custom clearance, being transferred to the central facility of the country. During those 92 days, you see that more than a third of the time, the product temperature was above 30 degrees, including several hours above 50 degrees. So it's like cooking your medicine, essentially. Right now, there are solutions, and one of them is in our portfolio, heat-stable carbetocin for the prevention of postpartum hemorrhage. And there's a lot more solutions that should be explored around product innovation, around supply chain innovation to manage this, to prevent medicines from degrading, to prevent tests from degrading, rapid tests, for instance, and make sure that the products we have are heat stable and heat resilient. And we have at United launched recently a call for proposal, and we'll be announcing an investment in this space very soon. We receive very exciting proposals to generate more evidence, first of all, because there is a lack of evidence around which products, which regions, which parts of the world are the most sensitive to this, how this will evolve with climate change, unfortunately not in the right direction, as we know, and then what are the solutions available. And then, so usually this is a quiz, but I will give you the answer. There's 3 sectors here represented on this page in terms of carbon emission. Aviation, health products, and data centers. It happens that they each correspond more or less to the same share of global emissions. When you look at CO2 emissions, about 2.5%. So as you know, healthcare is about 5%, but half of that comes from health products. Health products manufacturing is the main source of emissions when you look at health products, not so much the transportation, it's the actual manufacturing. There's plenty of solutions, whether switching to alternatives. We heard from the UK earlier in NHS that switching to some products that are low carbon alternatives, providing the same health benefits, is definitely a very good solution. We've seen something equivalent in HIV recently, but there's also a pathway to decarbonize existing and future medicines to make sure they're all low carbon. And I want to flag here, this is not just a matter of low carbon. I think it was mentioned earlier as well. It's also a matter of resilience. A high carbon product is a product that relies on fossil fuels, on gas, on energy, and lots of that. And in a context where prices are increasing or volatile, in a context where access even to fossil fuels can be a challenge for some companies, for some countries, it's a matter of resilience of healthcare to have products that are decarbonized. So in conclusion, all the examples are provided. We've tried to summarize them under the umbrella of what we call climate smart health products, which is guiding our investments, our work, making sure that no matter whether we're talking about a new medicine, a new diagnostic, a new tool for low and middle income countries, those tools are made climate smart, not harmful, resilient, adapted, and responsive to the needs of populations affected by climate change. A new family of innovation and a new family that should be considered a global good, requiring collective action and focus on equity. Thank you.
Thanks so much, Vincent. And as you can see, I think you can see why we're so pleased to work with United, because they're an agency with a very specific remit, if you like, within the wide scope of One Health or Climate and Health about bringing new products to market, but successfully integrates everything about climate change into everything that you do, whether it's the supply chain, looking at it from a resilience point of view, and so on. So it's a wonderful example of the partnership that the ATACH also supports. If I can move to the next speaker, I think we have Marina Romanello online. And Marina, again, a long-standing partner of the ATACH and also WHO. We've been proud to work with the Lancet Climate Countdown for many years. And Marina, if I may, in your short intervention, I'd like to make reference to the point that Kate left us with, which is about accountability to keep up hope. And the countdown is all about basically tracking progress or lack of progress. So maybe you'd like to give us a few remarks based on that. Over to you, Marina.
That's it. Thank you so much, Dermot. And it's so great to see so many friends, so many colleagues in the room. I'm so sorry I couldn't join you in person. But thanks so much to the government of France for making this event possible and for enabling online participation as well. So as Dermot just said, I lead the Lancet Countdown on Health and Climate Change, which, as you might know, is a very big research collaboration of over 300 researchers around the world. We work strategically with the WHO, and our work is centered around the production of evidence to monitor and track progress on health and climate change, or more often than not, lack of progress across many, many sectors. Our last report, we published it just before COP30 in Brazil. And in that report, we had perhaps the most concerning finding of the series of the Lancet Countdown. It was our 9th indicator report. Now we're working on our 10th. And what we found there is that 65% of the indicators in which we track the hazards, the impacts of climate change on health, had reached unprecedented levels of threats to health. This is breaking records from previous years and showing these rapidly increasing climate hazards that we are facing, that our health systems are facing, that people all around the world are dealing with. And talking about accountability, much of what we do, about kind of 4/5 of what we do, is actually focused on tracking efforts, tracking progress, tracking actions on addressing the threats of climate change. And there is where we also found very concerning findings. The vast majority, 60% of the indicators, moved in the wrong direction. And we also found reversal of previous progress that has been made. We all are very acutely aware of attacks to climate science, of attacks to climate action globally, and that is very, very accurately reflected in the data as well. Overwhelmingly, indicators showed lack of progress, but I did want to highlight that there's a few indicators where we are seeing progress. And these, by and large, are the indicators where we track progress made by the health sector. The indicators where we track progress on decarbonization on health systems, where we track adaptation and resilience of health systems, where we track education of healthcare professionals. There is where we're seeing progress against all of the other indicators almost. And I'm stressing this not so we can pat ourselves in the back. We all know that we're in a very grave situation and there's so much more that we should and could be doing, but to stress the importance of the health sector leadership. We know the work that the WHO has been doing in leading this space. We've heard also of Wellcome that is injecting funding and supporting and enabling all this work on climate change and health. The ATACH also emerging as a unique platform to ensure that that work happens. And we've seen the General Program of Work, the Belém Health Action Plan. Wherever you look in the health sector, we're seeing this huge evidence of progress, and that is transpiring and translating already into actions that effectively protect people's health. This is unsurprising. We're talking about evidence for action, and the health sector is perhaps the sector that is most guided by scientific evidence. That is crucial today, where we see scientific evidence under attack. We've seen withdrawal of critical funding for climate and health science. And we've seen doubt being sown on the undisputable evidence on climate change and health. But the evidence is unequivocal. We know through our data that if we respond to the environmental crisis through a health-centered approach, we could not only avoid about 500,000 deaths that today occur from heat-related deaths that are avoidable still through adaptation. We could not only prevent the continued spread of zoonotic and other infectious diseases and the environmental extreme weather events that are claiming lives, livelihoods, and well-being all around the world. But talking about cross-sectorial action, if we put health at the center of that action, if we listen to the healthcare professionals and the health evidence, we could deliver the transition towards healthier, health-sustaining systems while saving well over 2 million lives from unhealthy air, saving well over 10 million lives through healthier diets, and at the same time tackling the compounding crisis of climate change, biodiversity loss, and the environmental crisis. There's absolutely no doubt on the science of climate change. We've heard before, no least from the WHO, potentially the biggest global health threat of the century. We've also heard that tackling climate change is potentially the biggest health opportunity. The science, the evidence continues to back that up. But it's not now also showing that tackling climate change through a health-centered approach might be the only hope for a healthy and health-supporting future. So this gathering is fundamentally important. I'm so glad that you all showed up. I'm so sorry I'm not there with you. But I do think that we need to start focusing a bit more in how we respond to that science, not only producing the evidence, but actually responding to it. From the Lancet Countdown's perspective, we love publishing in the Lancet, but that's not our main interest. Our main interest is ensuring that the evidence we produce can support the actions and the very inspiring stories that you all have been sharing today to ensure that the response to climate change is evidence grounded. We are continuing this work, not least working as co-leads of the ATACH task team on indicators alongside the WHO, supporting countries in developing rigorous data that can inform and can guide effective actions. The stakes are really high at the moment. We have no time for actions that are inefficient. So we want to ensure that we can provide the evidence to support very efficient actions as well. We have what it takes to tackle this challenge, even as the stakes grow higher through a science-based community. We are all about making people's lives better. So we have everything that we need to win this fight. And as I mentioned, the Lancet Countdown is turning 10 years old this year. We're working now on our 10-year report. And we're still working in ensuring that we can deliver the evidence to enable that accountability, to identify threats, to identify the populations that most are challenged by climate change, and to support all of you in your response to climate change. We need to stick together as the science is under attack. And I thank once again the government of France, the WHO, and the ATACH for hosting this event, for having me here. And I'll just stop there, as I know we're a bit short in time.
Thanks, Marina. Brilliant as ever. I think, and thanks for that final message as well about sticking together. We had World Health Day a couple of days ago. The slogans were "Together for Health, Stand with Science," and it is one of the things that we have on our side. We have both the values and we have the evidence, and it's fantastic to hear that the indicators that are actually maybe giving some hope out of the Lancet countdown are ones from health. That we are doing what we have always said we wanted to do to actually lead the way on this issue. So thank you once again, Marina. So the final intervention, I think, on this panel we have from Germany and online. So if I could hand the floor to you, please.
Thank you very much. Yeah, many thanks also from my side to the G7 French presidency, Unit 8, and the WHO colleagues for hosting this event and your leadership here. Special shout out really to Maria Nera for your comeback. Very pleased to feel your competence and energy is back in this space. Fantastic. My name is Birte Frerich. I'm Senior Policy Advisor working for the German Federal Ministry of Economic Cooperation and Development, BMZ, and I was asked to give some input today on behalf of Germany. I try to keep it short. Next slide, please. Originally, actually, I was asked to provide a presentation about international climate and health financing, and then the slot was shifted now to this slot now from evidence to action, and I'm quite happy actually, as I would like to especially introduce some work we have been supporting through KfW Development Bank exactly in this area. So, but it's at the same time a sort of disclaimer that I will not focus on the situation here in Germany, but on Germany's role and the support in international cooperation, especially in low and middle income countries. Yeah, we have heard from several countries now how climate change is reshaping health and health systems across the world. We have a lot of data and evidence here available. Marina just repeated the situation. We have altering patterns of infectious disease transmissions, increasing heat-related illnesses and death, and the impacts from more frequent and severe extreme weather events. We can feel them on health infrastructure, but also directly on physical and mental health. So these impacts are placing extreme strains on health systems. They're driving up demand for health services. And it's all connected, as we know, human, animal, environmental health. Next slide, please. So in 2024, the initiative of the World Bank and the Asian Development Bank, a group of multilateral and bilateral development banks, they have come together as the Development Banks Group on Climate and Health. I'm just pointing that out because here the initial focus was to develop a common position on financing climate and health. It led to the joint roadmap for climate and health finance and action, was endorsed by development banks ahead of COP29 in Baku, and it was already sending a strong collective signal on where financing for climate and health should go. And then the crucial next step was then to turn that into concrete investment guidance and co-financing opportunities. So within the group, different working groups were set up to do exactly this. And KfW was particularly active in the Development Bank Working Group on Best Buys. And then this was also connected with the ATACH Best Buys group. So next slide, please. The aim was then to identify high impact, cost effective and scalable climate and health interventions that can really also help countries and investors, donors, partners to prioritize and to co-finance basically. So last year, this has led to the Smart Buys report, was developed, as I said, jointly with the Development Bank Working Group, as well as ATACH, and many researchers, institutions were involved, WHO, many universities from all around the world, including Uganda, Singapore, Mozambique, national health foundations, and so on. From our side, especially the University of Heidelberg was involved. And I would just like to highlight that this report pointed out 8 concrete evidence-based investment opportunities. They align perfectly well with the BELAM Health Action Plan, with other frameworks, and they are providing the evidence to address the health impacts of climate change and to accelerate basically financing in this critical area. So a set of options are offered basically to countries, cost beneficial actions to strengthen the health sector adaptation and resilience. And the 8 areas basically were the implemented heat action plans, integrated surveillance and early warning systems, climate resilient health infrastructure, drone-based medical supply chain delivery, community health worker-led climate health education for communities, text-based telehealth services for climate-affected populations, mental health services for climate-affected populations, as well as mosquito vector control. So overall, it spotlights proven, cost-effective clinical interventions from the disease control priorities, the 3rd edition, and they can really support now climate adaptation. They're highlighting opportunities where investment can deliver both immediate health benefits and long-term resilience to climate change. So I just wanted to point out that we have tools available, that we should really try to use them as resources for countries seeking to translate climate health commitments into investments. And I would see 3 key needs now. So one is the shared priorities. WHO and ATACH are on board to provide the normative framework. Development banks and multilateral organizations should translate it now into concrete investment pipelines. We have a common evidence base, and these partnerships with academia, like with all the universities involved in this process, they really help us work from the same data and metrics. And then the 3rd area is the targeted co-financing. So here also G7 and other donors, including us, we should use this smart buys. We could use these smart buys really as entry points for co-financing, no regret investments in climate and health. I come to the end. I know the time is short. I would, next slide, really like also to close with a reference from the World Health Day 2026. So that was like last Tuesday, where the World Health Organization called on people everywhere to come come together for health and to stand with science. And in the WHO framing, standing with science means not only respecting evidence, but also sustaining the cooperation and the trust that is needed for effective global health action. So, Marina, you also pointed it out. This has really become increasingly difficult. Global health is under pressure, geopolitical rivalry, donor fragmentation, more transactional forms of cooperation. But standing with science is the right message, and I would like to stress that we as governments need to be willing to support implementation, but also defend the cooperation, defend the fairness, the institutions on which the application of science depends. So we as Germany, we are committed to making climate and health financing more strategic, more evidence-based and coordinated. And we thank again WHO, ATACH, UNITAID, the French presidency for this leadership here. For turning the roadmap that I was referring to, but also other action plans such as the BELAM Plan of Action, the WHO Global Plan of Action, now into concrete country-owned measurements that protect people's health, climate health, animal health. Thank you very much. I end here.
So much again for a really on point, fantastic intervention. I can't think of a better message to finish on, that this is all about solutions and that you're talking about investments. So this is not, the things that we are promoting are not costs. They're things that actually will save people's lives. And if you put a value on human lives, the benefits far outweigh the costs. So that direction on investment is critically important. And thanks also for finishing with that final slide of Together for Health, Stand with Science. Absolutely perfect from our point of view. I think, so that brings us to the end of that panel session. I'm conscious of the time. It's lunchtime and Lyon is the capital of gastronomy. So I don't want to be keeping people for long. As I have the mic, I will just say a couple of words, and then I will hand to Jérôme as the host to close. But it's mainly thanks. I think we've heard a great deal of really positive stories here today. We do have political momentum. Despite the geopolitical headwinds, we have the backing for this initiative because the evidence is so clear that we have to do this stuff, and that this is really good stuff to do. And that's what keeps bringing us together. We have this broad vision. We have the overall One Health vision, and then even climate change and health is also a very broad field of intervention. And yet, one of the messages that I think we take away is that we don't have to do this alone. We can cover a broad area of work if each of us makes our own specific contribution. I was moderating an ATACH event the other day, and there was one after the other, there was an intervention about disease surveillance in Mali and then anesthetics in Wales. Wales, the country, not the marine mammal. We're broad, we're not that broad. But that was the kind of scope we're covering. And both of those things were absolutely on point. They were within the scope of what we wanted to do. And the ATACH actually provides a broad enough structure and a clear enough structure that we're able to direct people to either resources or to working groups in order to take forward that area of work. And I think the final thing is just this absolute focus on solutions. We know it's bad. We know climate change is threatening and impacting health. We know that the other aspects of environmental degradation are also really bad for health, but we don't focus enough, I don't think, on saying what we're going to do about it. So we also have a forward-looking agenda, and Jérôme has already mentioned the high-level event planned on the 25th of June. And please do sign up to the ATACH. Please do join the community. Finally, a big word of thanks to the WHO team, the ATACH team, which has put this together. A huge thanks to the French team, who have been an absolute pleasure to collaborate with. It's been extremely smooth. So thank you once again, merci, and over to you, Jérôme.
So, dear colleague, first of all, on behalf of the French Ministry of Health, I would like to thank you, Darmit, for a brilliant moderation of these sessions and panels this morning. I would like to thank all the panelists also for interesting intervention. Interesting in the sense that we went through all scales, from local projects, very concrete projects, to national program and plans, and also global consideration with the ATACH work and the declaration and plans that we are all supporting. A personal message for me is that, well, we addressed also a key and important aspect, that's focusing on needs and on risk for population that are the most exposed to these threats. Is very important to reconnect dots with the society, civil society, with those are the most exposed to vulnerabilities, which means that I think this is the program for the next months. And in that sense, Maria, Che Guevara is important. We need to face difficult audiences that either are ill-aware or doubting or are skeptical about our actions and the results of the project. So we need to discuss with them. We need to present evidence that will be extremely important. It goes from finance ministries to more skeptical politicians, to the citizens and the lay people that need also information and that need to understand that their daily issues, their daily problems will be addressed by this kind of project. I think this is a key message. So we are between us, we are all convinced this is an easy audience, but we need to face also more difficult audiences tomorrow, very important. What we have heard today clearly shows one thing: international cooperation and multilateralism are essential. Across all regions, we heard concrete efforts to strengthen the resilience of our health systems, accelerate climate action, mobilize innovative financing, and foster cross-sectorial approaches. Our exchanges also reflect a growing and now undeniable reality. Climate change and health are inseparable. The health sector stands on the front line of climate impacts, and yet it is also part of the challenge. In France, for instance, it accounts for more than 8% of national greenhouse gas emissions, and this calls for continued and intensified actions. Because the links between climate and health are not abstract, they directly affect the daily lives of our citizens, as I said, and the functioning of our health systems and our capacity to respond to crises and risks. We already have important tools at our disposal, and the first one is ATACH and the Belém Action Plan, for instance, but ultimately the political momentum depends on us, on our level of ambition, on our capacity to convince, on the strength of our cooperation, and on our ability to sustain political commitment over time with evidence-based data on savings and cost of action and saving of action and cost of inaction. France remains fully committed to this collective effort. We will continue to work hand in hand with all of you to build health systems that are more resilient, more sustainable, more equitable, for the benefit of both present and future generations. That's why we also need to engage the younger generation. Let me now officially, first of all, thank the co-organizer, WHO, ATACH, UNITED. Very important. Thank you for this joint organization. And to close also this meeting, as well as the Health Working Group, G7. And I would like to thank all the speakers again and participants, whether they join us here in Lyon, in this beautiful city of Lyon, and online. And I wish you a safe journey back home. And I look forward, we all look forward to meeting us again in June, as you say, in Paris on the 25th of June for the high-level meeting. High-level meeting, that also means not only high-level politicians, but also people connected to the ground. Thank you very much. See you soon.